Motherhood is the best thing ever. However, it leaves undesirable signs on a woman's body. Mommy makeover is a complex surgery that helps to restore the appearance. It's finally me time for a woman who always there for her family members. We in GlobalMD receive many questions regarding this procedure. That's why let's talk to a doctor with 20 years of experience and many mommy makeovers done, Dr. Rafael Velasco Marin. Hello, Dr. Velasco. How are you this morning?
Thank you.
It's great to see you here, and let's start. Can you please tell about your professional experience?
Yes. Well, I made 6 years of medical school. After that, I make 4 years of general surgery specialty. And after that, 3 years more of plastic aesthetic and reconstructive surgery. I finished my training in 1992. And since that time, I have been working here in private practice in Cancun, Quintana Roo, Mexico.
Oh, it's so many years.
Yes.
Yes. Okay. So let's talk today about mommy makeovers. So the first question is, what procedures should be included in the mommy makeover?
Usually, we can do in a mommy makeover an abdominoplasty or a tummy tuck, a liposuction, but I don't perform liposuction. I do liposculpture, ultrasound assisted liposculpture. In that way, I'm able to remodeling the entire body contour, for example, liposculpture of the abdomen, the waist, the upper and the lower back. And we can use that fat in order to make a more rounded trim body if the patient wants. Also, we can do breast augmentation and also a breast lift in the same time.
Mm. So how many procedures can be done at the same time?
Maybe 4 or 5 procedures.
Okay, and it will be okay?
Yes. For example, in former times that will not be wasn't possible. Yes, but with the actual techniques, we can do these procedures safely. For example, with the ultrasound assisted lipoplasty, we don't have a great blood loss. Yes, and that's
Mhm.
because we are able to do this kind of procedures.
Okay.
The mummy makeover lasts in the operating room for at least 6 hours. Yes.
Okay, 6 hours in the operation room.
Yes. And the patient has to stay for at least 1 or 2 days in the hospital. After that, the patient can be released. The thing is the patient has to be wearing a drainage that has to be in place for at least 5, 6, or 7 days. After
Mhm.
that, we can remove it. We ask the patients to be, for example, here in Cancun for at least 10 days after the surgical procedure. That way, the patient can return safely to her home.
Okay, yeah, that makes sense.
Yes.
Doctor, how much weight do I lose with a mommy makeover?
Well, that depends of the patient weight, yes, but these kind of procedures are not for losing weight. The purpose of these procedures are to remodeling the body contour.
Okay. And do I have to lose weight before a mommy makeover? And why?
No, that depends of every each patient, for example. That's very important that we have to know or to look at the actual shape of the patient. Also, we have to be certain what is the correct weight of the patient, and then we can discuss the plan with the patient.
Okay,
But there's
so
no 100% need to lose weight before the surgery.
with every patient, you talk before and you see if uh,
If they are good candidate, yes. We have to
okay,
choose every procedures in order to fit correctly that procedure to every each patient.
who is a good candidate?
A patient that has, for example, has been with 3 or 4 pregnancies and doesn't want to have any more child, for example. A patient that have hanging and loose skin of the breast, of the abdomen, and localized fat, for example, in the waist or in the thighs, or the outer space of the inner aspect of the thighs.
And what if I do mommy makeover and then get pregnant again?
Well, you can lose the result. When we do a tummy tuck, we not only cut the redundant skin, we also tie the muscles of the abdomen. Yes, and for example, if a patient get pregnant after this procedure, you can lose the result.
Okay, got it. Doctor, how long is recovery from the procedure and what to expect during this time?
Well, the patient has to be for at least 2 days in hospital, but the patient is not going to be completely lying in the bed. He has to be sitting for a while, walking for a while, and resting in the bed for a while. Once he is discharged from the hospital, she has to be walking in the recovery home. Yes, he has
Mm-hmm.
to be resting and walking and walking. By the fifth, sixth, or seventh day, we remove the drainage. Yes. One day more, she will be able to go, for example, outside and go to the mall and everything like that. But you have to consider that the patient has to be discharged wearing the compression garment. That's very,
Okay.
very important. We our patients are like this. For example, by the 12th day, they will be able to beginning going to make exercise. Yes, like bike. For example, by the fourth day, if the car is automatic driving, they will be able to do it. We consider that the patient, with 1 month after the mommy makeover, they have to be making entire normal life.
Ah, okay, because that was another question. How soon I can work out, stretch, and everything
But
else.
by the 20 day, you will be able to do mostly whatever you want. But after 1 month, you will be entirely recovered.
That's that's awesome. And how can you please repeat how long do results last?
Well, that depends of the patient. For example, after this procedure, the patient will have a very good result, but that result will be maintained if the patient, for example, have a proper diet and, for example, make a workout. Okay, that
Hmm.
depends on the patient. Mhm.
Okay. And is it okay? Is it okay to have the surgery when the woman is in her period?
That will not be comfortable for the patient. We prefer to do it after 1 week after the patient finished her period.
Okay. And another question, how to make sure my belly button will look good after a tummy tuck? This is pretty frequent question.
Yes. In the interview before the surgery, we have to ask the patient what type of shape of the belly button she want. Yes,
Okay.
that's a very important thing. Some patients want to be completely round. One patients want to be like a heart shape, something like that. It's very important to discuss with the patient before the surgical procedure.
Okay. And do you give any guarantees?
Well, in medicine and surgery, there's no strictly guarantee of nothing. We can ensure that we can do the best in our knowledge to have a very good result. But that depends only with a good result depends not only the surgical procedure. It depends only with the patient cooperation. That's very important.
Awesome. Thank you very much, doctor.
You're welcome.